Two of the federal government's top health officials painted, what could be a very grim picture in the months ahead during yesterday's Senate hearing. And they're warning of an inevitable uptick in coronavirus cases as restrictions are lifted in some states across the country. So we want to bring in Dr. Neeta Ogden. Dr. Ogden, you are an internal medicine specialist. So, what I heard, I think, as a kind of the prevailing message was that, of course, as restrictions are lifted, doctor, there is an expectation that there will be new cases. That's to be expected. What they don't want are so many cases that the health facilities are overrun once again. And I remember Dr. Fauci saying that we need to be able to identify, isolate, and contact trace. And he seemed to think that we weren't there yet. What was your biggest takeaway?
Yes, exactly. My biggest takeaway from the hearings was that both Dr. Fauci and Dr. Redfield sort of resoundingly said that we're not ready to start reopening our country, that we need to use a guideline, phased-in approach where states need to sort of fulfill certain parameters before they start opening up certain types of businesses and even schools. And I agree with you. I think the biggest risk here is that by opening up too early, we start seeing outbreaks. And that leads to, we know that the coronavirus is highly contagious. An outbreak can lead to a lot of people being infected and dying and straining an already overwhelmed healthcare system. I think the other point that they made is that for us to feel safe about reopening in the absence of a vaccine is to have very robust contact tracing and testing. And they're right, we're simply not there yet as a country.
So, Dr. Ogden, one of the things that Dr. Fauci and others have talked about is certain guidelines that need to sort of be established before states and communities choose to reopen. And they have to be able to point to a decline in the number of cases. And more importantly, they have to be able to show that if there is a spike, so I think people are sometimes mixing up what needs to happen. It's not to say that the world can never go back, or your community or your state can never go back to the way it was. There is a point to make that if there is a spike, that the hospitals and the medical system that is in place in that particular state can handle a sudden spike or an influx in people who come down with COVID-19 or who have other infections that may arise as we get closer to flu season. And a lot of these states are doing that without any of that in place. It's hard for me to understand the calculation that an elected official is making with regards to people's lives.
No, I think you're right. And I think it's this balancing act about, the health of our country and the economy. And there's that struggle. And I do think that you're raising a really good point. We're seeing in other countries that did a great job initially in containing the virus and opened up. For example, China and South Korea have now had outbreaks, but they work very quickly with contact tracing and testing to contain them. And we just have not seen this in place in the United States. I read that there was an outbreak of 5 new cases in Wuhan, and now they're planning to test all 11 million residents. So for that to happen in the United States, we would need millions and millions of tests every day. Senator Alexander actually brought up an interesting point about a different kind of testing, which is called antigen testing, which is more point of care that we could use on a daily basis for students before they enter school. But again, we're not there yet. These are great things that we hopefully will have in the future. They're not there right now. And until these kinds of either the vaccine or the testing plus contact tracing are really, really put into effect, it is unsafe, and it could very, very, very quickly overwhelm our healthcare system.
And we also heard from Dr. Fauci that there are a number of different groups or companies working feverishly on a vaccine. I can't remember the exact number, but I think he might have said like 7 or 8. So there's a lot going on.
8.
And he felt that that was a good thing because it would allow us to accelerate the typical pace that it normally takes to get a vaccine out. But he also said it's not going to be out by school time, like September,
right.
fall. He has consistently said the new year, which is super fast anyways for vaccines.
Right.
I guess, but also, I mean, as somebody who would be a patient, a consumer of that vaccine, I still sort of wonder if rushing this is good. Can we get a good vaccine that does the job, that isn't harmful, if we're rushing it the way we are?
Yeah, I think he really spoke to how there's no guarantees here, and that we certainly could end up with a vaccine that doesn't work. How would that, number one, it may not create a strong enough immune response so that if you're exposed to the virus, it may not be enough or it may not be durable. Another scenario Dr. Fauci mentioned was that if the vaccine actually made things worse if you were exposed to the virus, and sort of increase the pathogenesis of the virus. And he mentioned two other vaccines that did that, in the past. However, I was very hopeful because he did speak very positively about how our body responds to coronavirus and is very effective in clearing it in many cases, and that is hopeful in terms of a vaccine actually being effective and working. But there is no doubt that this is the most rushed and unprecedented territory in terms of making a vaccine, and there's certainly risks involved with that. So I think that we have to sort of proceed with what we have and really hope for the best.
Dr. Ogden, one last point before we let you go. Some states have turned their focus toward contact tracing as a weapon against COVID-19. We've seen that in other countries. For example, you probably saw the news that there was an individual in South Korea in the last week or so who went out to a couple of bars in Seoul, and immediately the government, rather than putting into place the social distancing and lockdowns that we have in this country, they set about finding almost everyone who happened to be in those bars where this individual went to trace them and to see whether or not they have become infected. How effective could that be against the fight against an illness? In other words, letting people go back to work, letting businesses reopen, but contact tracing, a robust contact tracing program.
Oh, I think it would be immense. In the absence of a vaccine, robust contact tracing, and that goes along with testing, are going to be what allows us to reopen up our schools and the economy in general. And that case in South Korea is really remarkable because they did act very quickly. I believe they already tested 100 people that may have been tied to that nightclub. But just to show how infective and contagious coronavirus can be, they believe that 5,500 people were in contact with that nightclub. So there's so many levels to contact tracing that it has to be really done in a very systematic fashion. You can see what an extraordinary system has to be in place. And we don't see that yet in our states, but I do think that we're moving to get to that place. But again, without a vaccine, we need contact tracing, and we need a workforce behind contact tracing. We need compliance from the residents of the United States to be able to have their phones tap into their information in that way. So there are a lot of pieces to this puzzle that still need to be resolved for it to be effective.
Hey, that's a really great point because I think, South Korea in particular probably has like the most smartphone use in the entire world, and that probably helps to make contact tracing a little easier. Dr. Ogden, we could talk to you for like another half hour here. You were so interesting, but we got to go because there's other news. Thank you so much.
Thank you for having me.